All right, good morning, everybody. We'd like to thank everybody for joining us today for our webinar where we will be discussing COVID disease investigation and contact tracing with Outagamie and Winnebago County Public Health. My name is Tanya Belter. I am the VP of Member Services here at the Fox Cities Chamber of Commerce. And today's presentation is brought to you as a part of our Stronger Together series in partnership with the Fox West Chamber of Commerce and Heart of the Valley. So again, we want to thank everybody for joining us. We understand that this topic is very important in our community, and we are thankful for everybody who is choosing to join us. Today we have with us Karina Agmar, who is the Public Health Nursing Supervisor for Outagamie Public Health, Natalie Vandeveld, who is the Public Health Officer Manager of the Outagamie Public Health, Kimberly Gofford, who is the Communicable Disease Nurse Supervisor with Winnebago Public Health, and Doug Guerin, who is the Health Officer with Winnebago Public Health. So thank you all for being here. We understand that your schedules are very busy at this time, but we do appreciate you joining us to share what is very important information that is top of mind for everybody. So today's presentation will be webinar style. If you do have questions, we encourage you to ask those throughout the event by using either the Q&A or the chat feature, and I will continue to monitor those, and we will we'll ask all of those at the end of the event. If there is anything else, any other questions that come up, please feel free to ask. We do have, we will be recording today's session, and it will be available on our website, foxcitieschamber.com, after the event. So with that being said, I'm going to turn it over to Karina, who is going to get us started today. So thank you, Karina, for being here.
Okay, thank you, and thank you for allowing us this opportunity to provide some information and then also learn more about what questions we have in the business community. So today, like was mentioned, we're going to talk about COVID-19 disease investigation and contact tracing. So we'll go over very briefly the definition and history of contact tracing in public health. We'll talk a little bit about what's involved with contact tracing. We'll mention some different steps that a person could expect if they are diagnosed with COVID-19 or their contacts. We'll review some best practices for businesses and provide some resources. And then there will also be a lot of time left over for questions. So contact tracing is one of the oldest tools used by public health to prevent the spread of disease. It's a process that involves identifying infectious people, those they have come in contact with, call them and notify those people of appropriate actions that they can take to reduce the spread of infection in the population. Public health contact tracing activities have prevented the spread of disease for decades. For instance, we were able to eliminate smallpox largely due to vigorous contact tracing to find and isolate all the infected people along with immunization. So contact tracing is used along with other tactics such as testing, isolation, and quarantine to contain the spread of disease. And not only COVID-19, but tuberculosis and measles are other diseases that we have used and continue to use contact tracing for. So COVID-19 is a reportable condition, and public health is notified by labs or providers of positive tests, as shown in this slide. When we are notified, we call the positive case, and what we do is we conduct an interview. During that interview, we use a risk assessment tool to identify people that may have come in contact with that infected person and would be considered exposed. People that were exposed are called contacts. And then there are guidelines set forth by the state so that all local health departments are using the same criteria for determining who meets that criteria for being a contact. And then the interviewer will reach out to those contacts to notify them of their exposure and then determine what the next steps are. And then I will hand it over to Kim.
No, I just happened to see a comment pop up. Are participants not seeing our screen?
I had, oops, sorry, hold on one second. I had checked He's saying it's still on the first slide. I have a couple staff members who are on today who are joining us as well, and it seems as though they are able to see the slides. So, and a few people, I see other comments coming in that other attendees are able to see them as well. So I'm wondering if it's maybe just an internet connection issue for some.
Okay, all right, well, sorry about that. We have tried to use more fun graphics in this slide than really scientific things. You're not missing out on any graphs or anything like that. So hopefully that your internet speed catches up or whatever. So anyway, I just wanted to touch on a little bit more in depth some of the things that Karina talked about. Actions following a person who is diagnosed with COVID-19 and their contacts. We looked at the box it in strategy slide a few slides ago that said test, isolate, find, quarantine. We heard a little bit about the history of disease investigation. So it is a tried and true practice. It's not anything that we just started using with COVID-19. As Karina said, there have been other diseases as recently as measles where we've had to do this as well. So public health is not new to the whole contact tracing methodology. We really looked at the bones of contact tracing, the last slide that Karina shared, you know, kind of the whole what triggers contact tracing, and it's the notification that there is a disease. So how does all this fit together, and what does it mean for people who aren't in the medical community? So if I could have my slide advanced, please. So it really is a puzzle, and fitting it all together really does fit together like pieces of a puzzle. So the very first puzzle piece is test. And I've written this in the same order as in the box it in strategy that you saw on a slide, and you will see from the state of Wisconsin as well. So that really is the trigger, a positive test. The next term is isolate. So I really wanted to stop and do a little definition clarification for everyone who doesn't live in the COVID-19 world like we do. Isolation is for the ill. So if you think about that, I for isolate and I for ill. So we isolate people who are sick with COVID-19. Quarantine is for people who are exposed and may become ill. Public health works very closely with a positive person to identify how long that person needs to stay in isolation. That's a big worry for somebody when they're diagnosed with COVID-19 is, you know, how long do I have to stay isolated for? There are general guidelines that public health follows, but each situation can be unique. There has been this has been an impact beyond the person being isolated as well, though, and we realize that when we're isolating somebody, a business can be affected, healthcare systems can be affected, schools, emergency response services, if the person who tests positive happens to be a firefighter, a law enforcement, EMS person, all of those public services can be affected when a positive case is identified. So that leads into the next piece of the puzzle, which is find, and this is so important. This is where we can really make a big difference. Contact tracing is a no judgment zone. When public health calls somebody who's been identified as a contact, we are not there to lecture somebody. We're not there to judge somebody on how they got exposed. We're as anxious as everybody else to eradicate COVID-19. So our job is not to judge and just to get facts and to educate. Quarantine. So this can be really tough. Again, we realize that many factors go into somebody's ability to quarantine. And again, quarantining somebody can have an impact beyond that person being quarantined. Again, healthcare systems, schools, emergency response services, and businesses can all be affected. So public health works with many employers and service providers to educate and guide those service providers and those employers on what to do next. So then I think we can take a look at what some of those best practices for businesses are.
Okay, Great, thank you, Kim. And I can review a lot of these best practices, and a really great resource that we'll talk about more is from WEDIC. So some general things to consider are really how can you minimize the risk for people that are coming into your place of business and then employees. Think about how to inform and educate workers and customers about prevention strategies that you're taking in your business, and have different policies in place. And some policies for consideration are those related to social distancing, employee screening, business travel, assessing any kind of leave policies that you may or may not currently have for quarantined or isolated workers. And then those also caring for people who are in quarantine or isolation. Another point of consideration is to determine how you will operate in case you have a big spike in absenteeism, to have like a plan B and maybe even a plan C. And then have a plan to identify and respond to newly ill people. So what those exclusion criteria would be for your place of business, and what those return to work criteria would be too. Or if that employee has symptoms, for example, maybe they didn't get a test, what would be your plan of action if they did test positive, and what your plan would be if they were considered a contact. Another best practice would be to follow the CDC and Wisconsin guidelines for allowing suspected or confirmed employees to return to work. And I'm sure we'll get into that when we talk more about what the questions are that you guys have. Here are some resources. So a lot of the best practices that I mentioned are primarily from WEDIC, and within WEDIC they have the resources for CDC, OSHA, and then also local health department. This is something that not one entity can do alone in this response to COVID-19. So we're all in this together, and that's part of the reason we are so excited as a health department to be offered the opportunity to discuss contact tracing and hear more about what questions you guys
have. Karina, I did have a couple of questions that came through, and both of them are similar in nature. There's a first one who both of them are talking about having a scheduled COVID test and then either not showing up for your test, or perhaps going to your test and running out of time, waiting in line and then running out of time and not being able to complete your test. So there's been some information out there stating that if that is the case, if you have a scheduled test and you either don't show or you get there and run out of time, that those tests are being counted as positive. And they're wondering if that is accurate, and if so, why that is.
Okay, I want to make sure I understand the question. So there's a question that a person is waiting for a test, and that test is being counted as positive?
So basically, you schedule the test, you show up to test. Either you show up to test and you run out of time, maybe there's a time constraint and they're running behind and you're not able to get your test done, so you have to leave prior to being tested, or you schedule a test and inadvertently forget or don't show up for some reason and your test is not performed. They're saying that in either case, if there's a scheduled time and the participant is not there to be tested, that test is then marked as a positive result, even though it wasn't technically ever performed.
I'm not aware of any situations that occurred, unless maybe, I don't know, Kim, have you ever heard of that?
I have heard that expressed as a concern as well, especially on social media. And I have not seen any cases of that or had any cases brought to my attention where somebody tested positive and didn't actually show up for the test. Is it possible? Maybe. Do I think it happens a lot? I can only speak from my experience, and I haven't seen it. You know, and I think in Karina's position and in my position, we obviously don't see every single test result that comes through, but our departments would be the one that would be notified of that. So I haven't seen it. I can't validate it or invalidate it.
Yeah, and we wouldn't be able to follow up or really count somebody as a positive until we had that positive lab. So like Kim mentioned before, it really starts with that positive lab. That's what gets the ball rolling. So I'm not sure who's counting it or how it would come in, but from public health's perspective, we don't do anything until we get that positive lab.
I mean, that's true.
Just following up with the disease investigation.
Yeah, we would call the positive, and if the person was, saying, hey, I didn't actually have the test done, there would obviously be a big follow-up from public health to whoever reported the positive test, whether it was a health system or if it was a National Guard site one. We would be going backwards and doing some backtracking to try to figure that out.
Okay, perfect. Thank you for that clarification. Another question that we have, and I think this is an interesting topic, with the flu season coming up, this particular employer is wondering how they are to differentiate between regular flu and COVID as an employer.
Okay, well, I'll start on that one, and others can chime in. I mean, honestly, the overlap between the two is definitely on our minds. So I don't think it's up to an employer to bear that burden of deciding whether your employee has flu or COVID-19. The only way to differentiate between that, or even seasonal allergies comes up as well. Those of us who have bad seasonal allergies this time of year, that throws a monkey wrench in things. So we would really rely on testing for that. I mean, the flu's serious too. This isn't COVID-19 shouldn't downplay the seriousness of the flu either. So you will likely see public health really pushing for everybody to get a flu shot this fall, just because that is something that we have treatment for and we have a vaccination for. So, until you get tested, you really won't be able to tell the difference between the two because they're both a virus and they cause very similar symptoms.
Interesting. Thank you very much for that. Another question that came in, and again, for the attendees that are with us today, please continue to send questions through. This is a great opportunity to be able to ask from these subject matter experts. So we welcome you to continue to send your questions. The next one that we have here is who technically is considered a contact? What would the criteria be for you to be considered a contact to somebody who has tested positive?
I can answer that one. So we use the risk exposure assessment from the state to determine who is a contact, and really in a typical work setting, the primary factor is being 6 feet within another person for longer than 15 minutes. There's other factors to consider too, such as if you were sneezed on or coughed on by a person, but usually the primary factor that I've seen that's a really rare occurrence. It's usually being within 6 feet for longer than 15 minutes.
Okay, perfect. Thank you for the clarification on that. Another question that we had come in, it states, if someone has symptoms but has received a negative test back, how soon should they be allowed back to work? This particular individual, they're stating that their company procedure is that they need to be symptom-free for at least 24 hours, and they're wondering if that is sufficient.
Well, I can start with that one, and others are free to chime in. There's a little bit of, I'll qualify my answer just a little bit. If somebody is a contact, so let's say somebody has been contacted by their local health department and they're under quarantine. A negative test result will never get you out of quarantine sooner. So in that instance, we would say you're a contact to a positive case. You went and you got tested. It's negative. What that tells us is that that point in time that you were tested, you were not infectious. It does not tell us what happens the next day or the day after that. What's called the incubation period of this virus is between 2 and 14 days. So, you know, it is possible on day 13 for somebody to show symptoms. So that's the answer if you're a contact. If I call in sick with a sore throat and a cough, and I call my doctor's office and they say, we want to get you tested for COVID, you sound pretty symptomatic, and I get a COVID test and that comes back negative, then we would say you can rely on whatever your typical return to work policies are for that, at least 24 hours being fever-free. If somebody has strep throat, you don't want strep throat going through your facility right now either. That's not going to do anybody any good. So that's kind of the difference. If you are ill, you should be able to count on that negative COVID-19 test result as a valid result for COVID at that point. And you know, we always qualify that too by saying if your employee continues to stay sick and doesn't improve, then they need to call their doctor back and potentially get retested again. But in general, those are our recommendations for those two scenarios.
Okay, perfect. Thank you very much. So lots of questions coming in, which is great. Thank you for everybody who's sending those. Kind of in line with being tested and talking about, you know, having up to 14 days to exhibit symptoms. A question that we have is they're wondering why it's taking up to 10 days to get test results. And they're wondering if by that time, hasn't too much time already lapsed to really prevent spread.
This is Karina. So I can't really answer everything about why it's taking that long to get the test results back. There's a variety of factors, and I know that our health officers are working on different regional plannings about trying to address that issue. Maybe if anyone feels like they have more information. But yes, we are working on that. It is important that you follow the instructions, or that individual that follows the instructions from the provider about what to do while waiting for your test result, because it may be that by the time you do get your result, your infectious period is over.
Thank you. Again, in line with, did you want to add to that, Doug?
I certainly can.
Oh, perfect.
You know, it's, you know, ideally test results are as rapid as possible, you know, and certainly hopefully no more than 3 to 5 days at a maximum. The testing landscape is really complex. Every healthcare system uses a different laboratory system, either in-house or external. We also have the state lab and other labs that have come on, and so there's, you know, there's a lot of testing capacity in Wisconsin, but there different labs have different processing times. They have different sampling requirements. They may need to ship those samples to a more distant location. And so based on the volume that's going through and the availability of laboratory capacity, sometimes those tests can get delayed. If we know that we don't really want to use a testing service that that takes, you know, more than several days to get a test result back, because it's really not helpful to wait that long and give any meaningful information to the person that was tested. So we are working on increasing capacity. That's part of the reason the National Guard's here in our communities right now. Today they're in Oshkosh, tomorrow they're in Oshkosh, next week they are in Calumet County for 3 days. And if you have a symptom, we encourage you to go to those sites and get tested. And in the meantime, we are working actively as a region to shore up that capacity. Hospitals have been a bit limited recently just because of the testing materials. And so tests have been harder to come by, and there's a greater chance that you will be told that when you may be eligible for a test from your healthcare provider, they just may not have the capacity to do it, in which case then they'll provide advice for you in lieu of an actual test result.
Perfect. Thank you. Appreciate the extra information on that topic. Another question that we had come through is this particular individual has an employee who has exhibited symptoms such as like a stuffy or runny nose, but that's their only symptom. They called the COVID hotline and they were told that their symptoms did not qualify for testing, but now they have two other individuals in their office who have tested positive. They're wondering if the other employee who had the one singular symptom should now be tested as well because of the two other employees who have received a positive test result.
So I don't know exactly what that screening tool looks like that that individual completed, but there is different criteria for determining COVID-19, and it is like a 2-symptom, I guess, qualifier for certain symptoms. So that's most likely why. It is if you have 2 symptoms such as fever, muscle aches, headache, sore throat, or loss of sense of smell or taste, or one of cough, shortness of breath, or difficulty breathing. So I'm assuming that's why they were screened out. Now that person, what I'm hearing is they potentially met the definition of being a contact. So that is important information that they could be telling to their doctor, because that now if they took that screening again, they might get a different answer with having that information.
Okay, perfect. And this is in line with that, Karina. Maybe another thing that you could address. When a contact or someone who has tested positive is nearing the end of their quarantine and they have not shown any symptoms any longer, should the person get tested to get confirmation of not being positive?
So there's no guidelines that recommend a person get tested to be out of quarantine right now from the state.
Okay.
I agree. And given our limited access to testing, that it is probably not reasonable to require people to have a negative test upon return to work. What they are finding, and remember, it's called a novel coronavirus because novel means new. It's new, so we're learning more every day about this. But what we are learning is somebody can still test positive for COVID-19 30, 60, even up to 90 days in some instances, but that does not translate to them being infectious for that long. So that's why we've seen kind of some of the return to work symptoms and duration of symptoms, those sorts of things changed a little bit. Actually, it lightened up a little bit, and that's based on the science on what we're seeing. So it is quite possible that if somebody completed their isolation period, had improvement in symptoms, met all the criteria to go back to work, if you sampled them again, it is entirely possible that they are still going to test positive. And what happens is the test picks up on the dead DNA, just like it does the live DNA. And currently our tests cannot tell the difference between the two. So it's almost futile to be using a test-based strategy to return back to work. As a matter of fact, those guidelines even changed for healthcare workers, where for obvious reasons, especially if you're working with highly symptomatic or at-risk people is what I'm trying to say. They're not even suggesting that healthcare workers have a negative test prior to return to work because, one, we need to keep those tests available for the people who are symptomatic, and then two, it's not really giving us any good information at this point anyway.
Okay, perfect. So again, in line with the topic of testing, this particular individual had an employee go in for testing and they were told they were negative via a phone call. They're wondering, do people not get an actual result via an email or another email or another medium that shows they are negative or positive? So is a phone call sufficient, or should they be getting some additional type of confirmation? Oh, you're on mute, Karina.
Sorry.
No problem.
The test results should be coming from the provider. I'm not sure what, and that may be different. However, the provider is relaying those results. I'm not sure if they are using email to notify, especially at some of the testing sites like in Green Bay, if that's a way that people, where maybe it's not their provider that's doing the test. They may come in different than that, but typically public health does not inform people of their negative or positive results. Our role is really following up with that positive result and talking about next steps.
Okay, perfect, thank you. So this is an interesting question. In the topic of contact tracing, this individual is stating, I hear that there would be a solution would be to test everyone and then to quarantine those who test positive with those with other people who test positive or already known to have COVID-19. If this occurred and those who were quarantined were held until they were fully recovered, or they don't get it from somebody who already has it, would this eradicate COVID-19? Looks like Doug wants to answer that.
I'll jump in on that one.
Awesome, thank you.
Yeah, if I mean, this is transmitted from person to person. It's the only way it's transmitted that we're aware of right now. And so yes, if everyone was quarantined, for the incubation period, ideally 2 incubation periods, we would stop transmission. And so the whole point of orders like Safer at Home, and the whole point of doing isolation and quarantine is that if we can stop the cycle of transmitting it to another person, yes, we will stop. And we talk about this in terms of what our reproductive number is, or our R0 number. And when we can get an R0 number of less than 1, which basically means that you infect less, on average, one person infects less than one person, we'll start to see a decline in the rate of this disease, or the transmission of this disease. Right now, because we're pretty open and we've just started masking, we have people that are infectious before they have symptoms, or with this disease, we can see up to 40% of people being asymptomatic, so they could transmit it without even knowing they have it. We're not going to be very successful in stopping transmission. So yes, quarantine and isolation work. If we were to do it for the entire population, for 2 to 4 weeks, yeah, we could pretty much get rid of this. And that's basically what New Zealand did. I mean, New Zealand locked down their borders, had very strict protocols in place in terms of physical distancing and where people could go, and they wiped it out off the island of New Zealand. So the only place that's done it so far.
Interesting. So good information. Thank you for sharing that. I currently only have one more question left in the queue. So just for all of you out there who are attending the webinar currently, if you do have other questions, please pop those into the Q&A or the chat feature. The question that I have here is, to the knowledge of any of you panelists, are there any government health agencies using AI data, artificial intelligence data, to monitor COVID-19?
I can jump in on that. Not here locally. We know that it's being tested in some areas, but there's none of that that's happening here right now in terms of like a Google or another platform. None that we're aware of locally. And another piece I just wanted to, a couple of things I wanted to mention since we're out of questions, is that your local health department is your primary contact. And although you're hearing from Winnebago and Outagamie counties, just wanted people to be aware that those that are in the city of Appleton or in the city of Menasha, they also have a local health department that would be their primary contact, and who they would hear from if the residence is in those jurisdictions. And in terms of our contact tracing and disease investigation work, using Winnebago example as a county, so we're serving in our jurisdiction a little more than 150,000 persons in our area. And I just wanted to help put in perspective what kind of effort is required currently right now. And we've roughly 30 people right now working on disease investigation and contact tracing. Probably about a third of those are working on disease investigation, and that's pretty much full time for those 10 plus people. And we have another approximately 20 right now that are working probably a little better than half time, just doing contact tracing, and this is 7 days a week. So it's been, and we need to hire more people. We're not keeping up, and so as our cases increase, we'll still need additional capacity, and we further need additional capacity because so much of our routine work has been suspended right now. As agencies, we're largely just responding to COVID and not getting able to do a lot of our routine work.
Very good point. Did you want to add something, Natalie?
Yeah, I did.
Okay,
thanks, Doug, for that reminder. That's a good point, is that we've expanded our staff drastically to respond to the number of cases. Our current agency has 6 nurses, and we've expanded. Basically, our sanitarians have been doing nursing work, our community health staff have been doing nursing work, and then we also onboarded 14 contract tracers to help with our efforts. And we're seeing cases from 20 to 30 a day. So there's a lot of building that's happening in our agency to respond, to make sure that we contact the positives timely and do that investigation and contact the individuals that are close contacts.
In relation to that, I did have some more questions pop up, so I'm just going to work through those. But one of them is kind of in touching on what you're talking about, which is adding all of the staff to help. When does contact tracing start? This particular individual has heard that it's 48 hours prior to the test, but she's also heard that it's 48 hours prior to the test result. So what is the cutoff for that?
I can start with that, and I can say both. So it depends on the situation. Again, nothing is black and white when it comes to COVID-19, except that it's not black and white. If somebody is asymptomatic and tests positive, and we see this especially as mass testing happens, like at a business or at a healthcare facility, a long-term care facility, someone may test positive and not have symptoms, or they have such mild symptoms that they just think it's allergies. I mean, that's a big one. So if somebody is considered asymptomatic, they really can't put together when that headache started. It felt like their normal headache pattern, or somebody who has a chronic cough, those are tough when they test positive. So you have to draw a line somewhere, and what the recommendation is right now is that those people consider their test date as their date, and you contact trace 48 hours prior to that. Otherwise, if you are symptomatic, we go by the date that your symptoms started. So all of the disease investigators have gotten really good at helping people who are symptomatic kind of drill down to when did those symptoms start. And then the contact tracing will take place 48 hours before that. So that's why my answer was both.
Good information. Anybody want to add anything to that? Are we good? Okay. This particular individual is wondering, is there a way for college students to get tested prior to returning to campus, even if they have not displayed symptoms?
It depends on where you live. Around here, not likely. In other areas of the state or other areas of the country where testing is more available and asymptomatic persons can get a test, then that may be possible. And you may have seen the recent headlines too that UW has been allocated like something like $30+ million for testing at the universities. That will likely be used for symptomatic persons and then contacts to try to help prevent outbreaks from occurring on campus.
Okay. Good answer, thank you. Has there been any proof or research been done on whether someone is able to be symptomatic on 2 separate occasions?
I don't know if we have much information about a person being symptomatic. I think one of the questions that we get is, can a person become reinfected? And
Mhm.
there's very limited evidence about that right now. The thought is that yes, that is possible, although I don't know that we have much evidence that confirms that. The duration of immunity comes into play here, and I think the thoughts are right now that having an infection may confer limited immunity, but that immunity may wane within just a few months, and I think that's the best that we know right now, and that could change based on additional research. We're just still learning.
Sure. It's understandable. In the line of testing, we just talked about college students and not being able to necessarily be tested here if they're asymptomatic. But the question is, do we know why testing is not more readily available? If that's kind of the first step of trying to contain the disease, what is the reasoning behind not having adequate testing?
Well, locally, we've had a few situations occur just in the few months that we've had COVID so far. Some of it's been availability of test kits. Some of it's been availability of reagents. Some of it's been availability of testing materials. And at any one point in time, it seems to be some combination of those. The state is adding additional testing capacity. Additional labs are coming on. We hope we will get through this and have more testing available. But right now, we've been working primarily with our hospital systems on testing, and they have not been able to get adequate supplies to do the test. So it's not a lack of interest or desire. It's simply a lack of materials, and there's a lot of diversion of those materials right now going to other areas of the country that are much more heavily impacted and have a higher need for tests. And so when you're looking at, Arizona and Florida and Mississippi and, the areas that are in Texas that are hotspots right now, many materials are being diverted and not available here locally.
That's a good point. Natalie, did you want to add something?
I would agree with that. It's really, we're ramping up testing so fast that we're just trying to figure that out. And I guess it's important for people to realize that with testing, it has to be the right person, the right test at the right time, and really prioritizing those tests right now is our current status.
Okay, it's a good point. Thank you. I apologize. This question actually kind of goes back to a topic we discussed just a little bit earlier, but I think it's very relevant. This particular individual, they are looking at adding new employees to their team. They're currently in the hiring process. So they're considering having new employees take a COVID-19 test prior to starting and having them return a negative test prior to their start date. When you were talking about testing positive and whether the fact that you could test positive even if you're not still infectious, with that information, would a person who has recovered from COVID-19 still test positive potentially?
Potentially they could. And I would just preface this with whoever, if you are an employer and you're thinking about mass testing, to really contact your local health department because they can assist with that planning. They can discuss any considerations such as a specific question and come up with a plan. So whatever your local health department of where your place of employment is, you should connect with them first. I think Doug touched on this before. We have limited availability of what a reinfection or the possibility of reinfection looks like. Right now, there's the general guidelines is maybe about 3 months, but that's really dependent on the person. If they're immunocompromised, maybe they could become infected again. So it's really a case-by-case scenario. So that would be a really good question if you're planning on doing that, to connect with your local health department.
Okay. In regards to testing employees, another relevant question I think that's probably top of mind for a lot of employers is, should they require testing if an employee were to return from a vacation where they, for example, may have traveled out of state? Would it be a good best practice for them to require a test from that employee before returning to work?
And I can start with that one, and of course others can add on. Remember, a test is really a snapshot in time. So at the time that your employee gets that test, That's whether they're infectious or not. So, knowing that you can be exposed and not become infectious right away, this goes back to what Natalie was talking about with it needs to be the proper person, the proper test, the proper time. So it is entirely possible that that your employee coming back from vacation is going to be tested too soon and have a false negative. And knowing our limited resources around here regarding testing, unless you have a real high risk population that you need to be concerned about, it may not be the best idea for you to require your staff to provide you with a negative, because one, it might be an inappropriate test at the wrong time, and two, they may not be able to get one. So now you are having less employees available to work for you, simply because they can't get in a test. So that would be a great example of what Karina had just said, to talk to your local public health department about whether your business would benefit from that type of a policy or not, and kind of help you troubleshoot that.
Perfect. Thank you.
It's also the reason that, we are asking for all these precautions to help limit transmission. I mean, masking and distancing and hand washing, those are all designed to limit spread. And the better we are at limiting spread, when we do have somebody that is infectious, symptomatic or not, we can limit the number of people and hopefully, stop an outbreak from occurring in your facility.
Perfect, thank you. In regards to that topic, when you're talking about outbreaks within particular businesses, this particular individual had an employee who did test positive, but they have been masking, they're following very strict procedures on sanitizing all of their touch points. They've been doing all of those taking all those precautions since March. She noted that she called her local health department and she was surprised to find out that they didn't need to quarantine any of their other employees. She said she had been advised to have other employees that worked with the positive employee to just monitor their symptoms, even though some of those particular employees had been in contact with the infected individual for more than 15 minutes. She had been advised to follow whatever their particular company policy was about quarantining, and she's just wondering if that's the correct process.
So there may be, for Outagamie County Public Health, we recommend that anyone who was in contact with a positive case and meets that criteria quarantine for 14 days. There was some memos that went out from the state early on in this process that employers could implement their own policies, but that would be really a health department call, and you would work with your local health department to see if that is a model that is working to prevent the spread within your facility. Mm-hmm. Really, the best thing to do is to quarantine anyone who comes into contact, but we also acknowledge that there are certain sectors that would be considered essential. So that would be something to really, really have that plan hashed out. In general, it's best to quarantine. And someone from Winnebago, if you want to add to that.
Yeah, I can, and I'll do the standard disclaimer that we don't have all the details of what that case was, but Karina's spot on. There are people who are considered essential employees, and while that's not my personal favorite term, I think everybody's essential. That's the term that they use, and if you think about it, as I had said in my presentation, you can't. It's really hard to quarantine an entire fire department. Obviously, that would be bad. So there are some exceptions on what to do if somebody is exposed and they are an essential employee. And that's why I didn't get into that too much in my presentation, because that is very much a case-by-case basis, public health to business sector or service sector. Because there's a lot of nuances. PPE plays into it, where you're wearing correct PPE. There's just a lot that goes into it, and that's our job to know that and to help people through that. So without knowing that, there may have been some specific nuances to that case where they were able to do that. But just know that sometimes it's hard to compare business to business. you know, oh, well, this business over here, you know, got to have their employees work, and this employee, you know, this business over here. You know, just knowing, I say a COVID-19 response, it's an art and a science, it's both. So these little nuances that, that happen between the health department and a business or a service sector business really determine the next steps. So they can be different, and it can be confusing, and without knowing exactly what, you know, what case she was talking about, it's a little hard to get specific.
Sure. Kind of in line with that, I did have somebody ask, and I think it's really relevant at this point. You had just mentioned the fact that every business is different, right? So there are going to be different, the way that you proceed with positive, negative tests, that quarantining, all of that can be very different. It's on a case-by-case basis. But could any of you maybe speak to just some general, maybe best practices that might be good for businesses to consider with their staff as we work, especially going into, like, you know, they talked about now with the flu season and things coming up. I know that there aren't going to be specifics because it is going to be very different based on the business, but just, are there any things that come to mind that you're thinking like these are really key best practices that we need to consider as a community to really help prevent the spread of this as we move into the fall?
I would say that one of your best resources right now is the WEDC guidelines. You go to WEDC, and they have a very comprehensive set of guidance for employers by business type, and they, you know, they will lay out you know, for you, you know, what those are. We're happy to talk, you know, with specific businesses about plans that might work for them. You know, but our general guidance is, you know, is going to be to limit those common areas. You know, try to keep staff from, you know, being in close contact. Have all your staff wear masks that can wear masks. You know, put, you know, prominent reminders and signage up for your employees to wash their hands and keep their distance. And a really important thing is, you know, your employees outside of work, you know, engage in behaviors that may increase their chance of becoming infected. And so, you know, continuing to educate your staff about what they do when they're not at work mattering, and you know, and helping them understand the consequences of bringing an infection into the workplace, infecting coworkers, you know, the ability for a business to continue to operate, you know, what it means to be at home, and what those impacts on the business are, so that you know, employees understand that you know, if they decide to engage in activities that may be risky right now, that's a risk to the employer as well, and a risk to you know, to their employment.
Thank you. I realize we're getting close to the end of our time here. We've got about 5 minutes left, and I do have 3 additional questions here I'm hoping that we can just touch on real quickly. This first one I think should be pretty straightforward. This particular individual is wondering if either of your counties will be offering antibody testing or some other method of COVID testing, like testing through saliva.
I can start on that one. You know, right now, you know, there's 3 types of tests that are predominantly available: PCR tests, antigen tests, and antibody tests. The PCR and antigen tests are tests that we would use for a diagnostic, determining if somebody has COVID or not. An antibody test is not effective in determining whether somebody has a current infection. They will tell you if a person has had a past infection. Those tests are good when you're trying to determine the prevalence of a disease in a community, what percentage of the population's been infected. It's good for, you know, the blood center to check blood and see, you know, if somebody might be a candidate for convalescent sera donation. And so there's other applications for those antibodies, but really those are not good tests for a diagnosis. They're not good tests for a return to work. And I would definitely stay away from those. You really want to, right now, you really want to look more at those serum tests, the antigen tests and the PCR tests.
Okay, perfect. And then this one goes back to contact tracing a little bit, and I think we touched on this, but maybe we could just reiterate or expand a little bit. just can we talk about the recommendations for someone, for a contact who has been around someone who has tested positive? Should they make the decision to quarantine themselves if they know they have been in contact with somebody who's been infected? And how far down the line does that go? So from that person who's quarantining, do they then make the recommendation that people they've been around are also in quarantine, even if perhaps they hadn't been tested?
We do get this question frequently, and it's sort of like if you're a secondary contact to somebody or you're a contact to a contact.
Right.
So if that was the case, we'd all be in quarantine probably.
Right.
So, no, we don't recommend that if you know somebody who's in quarantine and is not sick, we don't recommend that you go ahead and quarantine yourself. Now, if you feel like if you feel like you get missed, because sometimes we hear those questions too, like, well, I wasn't named as a close contact. Why was that? So, it really helps us out when a positive case helps us and gives a heads up to all the people that they're naming as close contacts, just because it helps when we give that call. Those people who aren't named, I mean, if you are really concerned, you can call public health, or you can just, you could quarantine yourself. But again, if you're employed, that will be difficult if you don't have public health telling you that you need to quarantine. If you call public health, just realize that we cannot verify that your next door neighbor tested positive. We can take the information and we can guide you a little bit. But there's not a lot of specific information unless there's a big outbreak at a company or something like that that's well publicized. We could work with an HR department, going back saying, hey, we got a call from 3 of your employees. They feel like they're close contacts, and we can help the business kind of dig in a little bit more to make sure that they have identified everybody.
Yep. And I would just add agreement with everything Kim said, that anytime you put yourself, or willingly or not, anytime you are within 6 feet of another individual for over 15 minutes, whether that is all at once or throughout the day, you are potentially putting yourself at risk of exposure. So if you think that happened and then you have really good information and you want to go ahead and quarantine, it would be from the last day of that exposure for 14 days.
Okay, thank you for clarifying that, Karina. Appreciate it. And the last question that I have talks a little bit about, Kim, you just mentioned, we would all be in quarantine, right? And it's at some point, we can't go down that route. This question is in regards to, and we've heard a lot about this topic, herd immunity. So developing immunity to this virus. There's been some talk that that's really the only way to end this is to create some sort of immunity. So is there a reason why we're not trying to pursue that type of a resolution to this disease? And is that a possibility, or what does that look like? Or do we maybe not know just because it's kind of such a new thing to us at this point?
I can start with that one. So in order for us to reach herd immunity, we're going to have a percentage of the population that has some sort of resistance to becoming infected, and then not be able to become infected and transmit to others. We don't know what the herd immunity level is for this virus, and short of a vaccination, that would mean a very large proportion of our population becoming infected, and then assuming that they have immunity after that. Given the nature of this virus and other coronaviruses, right now evidence indicates that people are not likely to develop a long-term immunity, and so to have herd immunity may be difficult just through infection alone. Also, I guess I just got too many thoughts here running through my head. If we think of coronavirus as a virus that has the ability to mutate, that can act like an influenza virus, that we have a new vaccine every single year. So it's not like measles, where we can necessarily develop a vaccine that, you know, is 98+% effective, and effectively be able to wipe out measles if we really truly eliminate every case. This is a virus that's likely to stay with us, and that we will probably not eradicate. And so at this point, herd immunity for any length of time is probably not practical, and it's probably not worth the risks of infecting a large portion of the population because of the severe health consequences. There is, you know, if we think about, you know, vulnerable persons in our community, we have, you know, if we classify vulnerable persons or those that are going to have potentially a much more severe outcome to becoming infected with an underlying condition, we're talking like 40% of the population. So it's just not practical to let this run wild. Now, an example of that would be Sweden too, and I guess we're also trying to balance the health and economic consequences. You know, Sweden took the approach that, hey, let's do that. Let's let this virus run and you know, get it through our system and not shut down our economies, such that we'll come out better on the other end of this. And what they found out is that, you know, initially they did not have the economic consequences because everything stayed open, but the cases, the high numbers of infections and deaths, you know, skyrocketed, and then ultimately the public pretty much withdrew anyway, and they suffered largely the same economic consequence, but on top of that had all the healthcare costs, all the extra deaths, all those extra consequences that other countries were able to avoid and really end up in the same place. The other part is there's a lot that we don't know yet about coronavirus. When you think about how what it infects, I mean, when we have symptoms like loss of taste and loss of smell, that's a nervous system impact. You know, it attacks the cardiovascular system, it attacks the respiratory system. We don't really know yet what some of the long-term effects are, and what we're seeing, you know, is, you know, at least 1 in 5 people that have a coronavirus infection have symptoms that lag on for weeks before they're sort of returning to normal. So it's really a very, very risky proposition to consider trying to get to some herd immunity when we don't really know that immunity lasts, and we just don't know what the toll is going to be on persons over the long term.
Very good. Thank you for that explanation. I think that was very helpful. Appreciate that. So I think that's it for today. We are just about 5 minutes over, but I think it's very relevant information. I think it was definitely worth the additional time to get those questions answered. So I, again, want to thank everybody for being on the call today. Karina, Doug, Natalie, and Kim, I know that you're all extremely busy, and we appreciate you being here. So thank you again. I hope that you have some time this weekend to maybe relax a little bit. It sounds like you don't get a lot of that these days, but again, the webinar will be recorded and available at foxcitieschamber.com. So if anybody would like to share this information with their friends or colleagues, please be sure to do so. And be sure to watch our website, foxcitieschamber.com, for information on upcoming events as well. So with that, I will let everybody get back to their Friday, and thank you all for joining us, and we hope you have a great weekend.
Thank you as well. We appreciate it.
Thank you.